Stress management. Today we're talking about stress because it is one of the risk factors that causes heart disease, and we're just going to start with the definition of it. Stress is your body's response to change, no matter if it's good or bad. It doesn't always have to be bad news, such as death in the family or financial. It could be good news, such as an engagement, planning a wedding, promotion in a job. The body reacts to stress by releasing adrenaline, and adrenaline increases your heart rate and increases your blood pressure. Again, it's not necessarily all bad, but what we have to learn is how to manage stress properly. Stress does affect everyone. It just depends on how we handle it, and what is a stressor to one person is not necessarily a stressor to the next, so we just can't make judgment on people. You get physical signs as well as emotional signs. Emotional signs would be more anger, getting upset and crying. Physical signs, you do get nausea, vomiting, diarrhea, and you can get a lot of the flu bugs that go around. So we have to learn how to deal with stress immediately so it doesn't bring us down and cause too much stress on our heart with that increased heart rate and blood pressure. Stress does cause us to be less creative, less productive. We don't have much motivation, makes us non-compliant where we don't want to take our medicines, maybe not exercise. We start reaching for the wrong foods. Our smokers that have decreased their smoking will start smoking more, or even smokers that have quit smoking will restart the smoking. We do get very withdrawn and possibly depressed. Everyone deals with their stress differently. So we just have to figure what works for us. It has been proven that physical activity and exercise definitely decreases stress. And when you're here in cardiac rehab, we take your blood pressure before your exercise, and at the end we're taking that. And as you see, if you come in at a blood pressure of 120/80, by the time you're done with your exercise, you are usually below that 120/80. It could be as low as 110/76. Laughter has been proven to be a good medicine to all degrees of depression and stress. Some people need to use different relaxation techniques or biofeedback. Finding activities that we enjoy, or just treating yourself, going to have an ice cream cone. We females having our nails done or hair cut. And some people use the music. Again, it does cause us to have a lot of negativity in our life where we overeat or undereat, and both are bad. Reaching for the wrong food to eat. We go for our quote-unquote comfort food, which is usually chocolates and cakes and potato chips and everything that none of us should have, not only heart patients, versus the vegetables and fruit. We also tend to drink more alcohol, if you do drink alcohol, so we increase that, and we drink excessively on our caffeine. Now, the important part of stress management is a disease that's out there that is called broken heart syndrome. And within the last 10 years or so, the American Heart Association has continued to do research on the broken heart syndrome. And what broken heart syndrome is a temporary heart condition brought on by a stressful situation. No matter if it's a physical or an emotional situation. It's our body responding to the stress, and it makes us release the stress hormones or the adrenaline, which again makes our heart rate go up and our blood pressure go up. And what broken heart does is a part of your heart enlarges and doesn't pump well, while the rest of your heart is functioning normally but uses more forceful contractions. One thing that they've found in their research is this normally affects the women more than the men, but they're still unclear of the actual cause of broken heart. They just know there is a relation to that adrenaline or the stress hormones, and that there is a constriction of your smaller arteries, and usually these arteries are having a spasm just like a muscle does, and it spasms down, causes a heart attack, and then opens back up. People are taken to the cath lab because their EKG is showing a heart attack and their coronary arteries are wide open. There's no blockage in them, but they can see the spasm taking place. So there is still an actual heart attack, but no coronary artery disease that requires a balloon or a stent. The difference between broken heart and a heart attack is a heart attack is caused two ways. You either throw a blood clot to an artery that shuts an artery totally down, or you're someone that builds the plaque up in your arteries, and that plaque softens up, and then it breaks off, goes downhill, and when it flows downhill, you have a heart attack. Again, broken heart, you actually have no heart blockage at all. I've personally seen two patients, and yes, they were both two females that have had broken heart. One female came into the hospital, was shown to have a big heart attack, but had no coronary artery disease. So after the heart cath was done, the doctors went and talked to her more, and they found that she was an important person at a bank that was in the accounting department, and her last 2 weeks prior had been very stressful in the accounting world of the bank. The other thing they have related this to is because we women did not used to be able to be CEOs of hospitals or run for president or any big important person in any big business, that we do that because we've been brought up to be the caretakers of the family. Then you throw the hormones in with menopause, that we just carry a lot of stress. And so there's a lot of studies around that we now can have these big important jobs with the hormones going and being caretakers of the home, and you throw that all together and it causes a lot of stress, and that's why it's important to get your stress under control. The other female I had was here at Truman, and she came through cardiac rehab, did have coronary artery disease, did have a heart attack and stents placed, got about 2/3 of the way through the program, and then started telling me that she was having some chest discomfort. After talking to her, I contacted her cardiologist. They had set up for her to have an outpatient stress test, and before that stress test could be done, she actually ended up in the emergency room with a heart attack. She is someone that was going through a lot of stress at that time on a personal level. She had a very stressful job, but she has had a son that has been murdered. The anniversary is coming up, will be the 4th anniversary, but when she was having her problems here in cardiac rehab, it was the anniversary of his death, and it is an unsolved homicide, as well as his actual birthday. So she was feeling a lot of that stress. When she came in, they did see a heart attack showing up on the EKG. They took her to the cath lab, and they found that all of her stents were wide open, and she had no new blockage, but she was spasming. So she ended up being diagnosed with broken heart syndrome, and then restarted cardiac rehab, and she is doing fine now. But those are just two situations that I've actually watched to show the effect of what stress does on your heart. How do we treat broken heart? You treat it with medications just like we treat people with a heart attack. They're put on ACE inhibitors, which is like lisinopril, acupryl, quinapril, beta blockers, which is Corag, Corvedolol, Toprol, metoprolol, Lopressor. Some people that retain fluid are on the diuretics such as Lasix or hydrochlorothiazide or aldactone. And all of those medicines help reduce the workload of your heart so your heart doesn't have to work so hard. So they are managed the same way as someone with coronary artery disease. So it's very important to figure out what works for you to reduce your stress. It's important when you are dealing with stress here and you're having a hard time dealing with it, let us know. If we don't have the immediate resource, we have the resources to get you hooked up. We will start with social work and go from there. But getting enough sleep is very important. That stresses the heart. Try not to worry. Let's figure out what we control and what we can't control. Remember to laugh, remember to have fun, but have fun and talk to family and friends. And then just be thankful for who you are today and what you have in life, and learn how to do some relaxation. Take time for you. Do what makes you feel good. Any questions about stress management and how to deal with it and how it affects the heart?